Hello, everybody. It is great to be here one more time today. And my name is Gary Fowler, and I'm the CEO, president, and founder of GSD Get You Done Venture Studios, a premier AI and quantum venture studio located in the heart of Silicon Valley. I've been involved in 17 startups and several unicorns. I was on the original management team of Click Software, which was sold to Salesforce for $1.35 billion, and also Eva.ai, an AI HR tech company that I co-founded with Dr. David Jang. We believe that intellectual capacity is evenly spread around the world, but opportunities are not. So it's with great pleasure that I invite my guest today, who's joined us, Donna Edmonds, the CEO of BRAINBox Solutions. She's a serial entrepreneur and has had an executive level experience, either CEO or group leadership positions in large multinational healthcare corporations, and then raising capital for funding startups that change clinical practice and make our lives a better place. She's orchestrated and negotiated several exits, some of which were the top 10 diagnostic companies. She's led or been part of numerous executive teams. She's got an incredible background, and with that, I'd like to bring Donna on board. Hi, Donna. How are you doing today?
Nice to see you, Gary, and good to be here. I have to admit that I've looked at some of the former series that you've done, and it's an august group. It's an honor to be here.
Yeah, no, I appreciate that. Thanks for joining us. So, a little bit about your background. How in the world did you get involved in the healthcare profession?
I originally started out as an emergency medicine nurse who was specialized in critical care. I got a degree in business along the way, but I was at the bedside to start with in ICUs and emergency medicine. And I was recruited to industry I was running outside of Chicago, a large emergency medicine group that staffed several hospitals and staffed several what are now described as urgent care centers. So I was recruited to Baxter. It's headquartered in Chicago, because I understood how to talk to and push around a physician, I guess would be the best way to describe it. And that's where I really
Donna,
started.
do you have to push or you have to pull physicians? Do you push them or pull
them? A little of both. The one thing about nurses and doctors is they do know how to talk to each other. And really, if it runs well, you see yourselves as equal. And in an emergency room, it's always a team. So you learn how to discuss things with physicians and not look at them as something godlike. Let's just put it that way.
So, but the public looks at them godlike.
Yeah. They're human beings like everybody else. Some of them smarter than others, and we'll just leave it there. I've had the benefit of surrounding myself with the leaders in each of the spaces that I've had a leadership role in, and that's been very rewarding.
So how do you go down through? What's the difference between a great doctor and a mediocre doctor?
You are really asking provocative questions. I would say that science, the student of the science and the courage to do the right thing.
And what's the right thing? Is it in the patient's interest, or how do you determine what's right?
Oh, it's always in the patient's interest. It always has to be about the interest of the person in front of you.
I got a question for you, Don. Do you ever see situations where the insurance companies want a decision made that may or may not be in the best interest of the patient? Does that happen in the hospital?
When you're talking about that kind of discussion at this point, that's not usually the point where you're interfacing as much as the insurance company. It's usually after the physician's made the decision to ask for something to be done, that the consequences, really show up. There's all this pre-admission clearance that goes on now for elective surgeries. And of course, that's always contentious. It's always contentious, just put it that way.
Interesting. And then, Donna, I got a question for you. They have these concierge doctors now, right?
Yes.
So is it that big a deal to have a concierge doctor compared to a regular doctor, this one where you're setting it? Is it that much different?
I have one. We'll leave it at that.
There you go. Me too.
Well, I don't think I think physicians go into medicine to serve patients. The more and to make the world a better place and improve health, etc. And in general, they really want to help people. Um, a lot of them have moved to this kind of a model so they can in fact do that. I've always, I've been on boards of universities, so I can also academic medical centers, so I can always get access to the best physicians for a specific diagnosis or a surgical procedure that needs to be done. But on a day-to-day basis, I think the really committed ones have had to move to a balanced concierge medicine approach so that they can create the time to have the interface. This allows them to create the time to have the interface that they went to medical school for.
So, just it's interesting to me because I work a lot with ChatGPT now. So we're writing a book with Da Vinci and a lot of pieces. But, you talk about patients and advocates. So a lot of times those concierge physicians become advocates for the patient, right? And if you have somebody that's pretty well known, they can open doors and help you out a lot. And maybe the difference between getting to living and dying, right? I mean, it can be.
I'm not sure as I'd create that much drama around it, but they create enough time so they understand you and take the time enough to understand what's really going on. And just, you're not on your own as much. I will tell you that after 3 or 4 years with the folks that I'm with, it's like, because they set aside a great, an hour to speak with you. It's like, okay, I know what's going on. You can let me out of here earlier because you have that kind of a dialogue, but you have access to their phone, their emails, and they're very responsive. But they've taken the decision to create the opportunity, and you've taken the decision to allow that and get yourself structured so you can. Not everybody can do that.
No,
They're not.
I'll tell you an interesting story. I'm not going to name the hospital, but it's pretty well known here, and the university. But anyhow, I was in there. I had pancreatitis. I had some really, really hot sauce and ghost pepper sauce, and I put it on some ribs, and then I had some ice cream. It was bad combination. Anyhow, I went to this hospital. Very bad. And I went into this hospital in the emergency room. They found out I had some stones. And so I go in there into the emergency room. They admitted me to the hospital. I have a special kind of vet insurance where it's good in one state and not the other, unless it's emergency. Clearly it's emergency. Anyhow, it just so happens that hospital that I went into, I happen to know the board members of the hospital. I know a couple of them. And I go in there and I'm sitting around and I'm like in this unbelievable room sitting. And then nobody came for a couple of days. It was like weird. It was strange. So I happened to get on LinkedIn and wrote my friends. And I said, listen, I have a question for you. Is the service always this bad in the hospital? And it was not more than 30 minutes later, the chief staff nurse came in to see how I was doing. And then the was a director of surgery, like one of the top doctors in the hospital, came in. And everything changed at that point. It was just interesting how much those connections are important and how can we streamline it? I mean, this is for another conversation, but there's got to be something that can be done, seriously, Donna, to make it a better system for everybody, democratized for everybody, because, having the ability to be able to pay a concierge doctor to do it, not everybody has that ability to do it. And at the same time, it has to be done, right? And as our world changes and, economies go up and down, we got to figure out a better way to help each other. And I'm just fascinated by it because I went through it myself. That's why I got a concierge doctor.
Well, I will tell you that some of my very best friends are the chairmen of academic medical center emergency medicine programs. And, every day when they talk to me about, and I saw this many patients and discharged them from, in triage or had them treated in triage before they could even get into the emergency room. It's very frustrating for the really committed, and particularly emergency medicine physicians right now. Mm-hmm. And you're right, changing healthcare is top on the agenda. It's not the topic I thought I was signing up for today.
No.
I'm happy to talk about.
It's interesting because I'm having these conversations with so many people. It's like the topic of the day, and they're really concerned.
Yes.
the healthcare costs are going through the roof. I don't know about my own personal stuff. I know what's happening because I paid the bills for the company. But when you're talking $2,300 for 1 month's worth of health insurance, it's crazy. Now, why everybody can't afford that? What happens? And so I'm trying to figure out how we streamline the system. The reason I'm saying that is because I'm using ChatGPT and I'm working with some neurosurgeons on developing some companies. We're actually looking at some of those kind of issues. But it just didn't fascinate. I mean, you're right in the heart of it. So I get a question. So you come out, you do this thing. You're a nurse. You go to business school. You go to Baxter. You're doing public and private diagnostic and device companies. Then you move into Virginia Life. How did it feel going from a nurse to business?
So very early in my career, I often tell the story that when I was charge nurse in the emergency in the critic ICU in a relatively small hospital, a community-based hospital. So charge nurse meant I was the one in charge in the afternoon, and I asked the person I worked for who ran the ICU one day and said, "Why is it we always get the equipment that we need in the ICU, and the folks out on the floor, when I get floated out to there, are always short in the equipment they need or staff?" And she looked me in the eye and she said, "Because we're profitable, we're a profit center for the hospital, and they are not." So it didn't take me long. I mean, that was, I'm married to a businessman, a man who's owned his own business all his career, but you recognize that in healthcare is the same way. If you're in one of the settings that are settings that create revenue for the hospital rather than drain on it, or you can articulate the value, you're in a much better position to get the equipment you need, get the services you need. And, that really hit me very early in my mid-20s as to what you need to focus on. That's why I ended up, instead of getting advanced degrees in nursing, getting a degree in business.
Interesting. So, as you're going down through your career, you went to ImmunoArray. How was it going from being a nurse to being the chairman and CEO?
Well, wasn't one stop. Along the way, I ran an emergency medicine physicians group with 65 people in it. I was recruited into Baxter. That was probably the most profound shift. Because I had already been out and running departments. I was a director of nursing for a hospital right before I ran the physicians group. I ended up coming into Baxter at the group level. So I was never at a single company level. I was always at the group level. So I automatically was thrown in with, there were 10 of us running 7 divisions. So I was with really high quality people in a very good organization. It reflects back, but it was right after the American acquisition. So they, I'd post-merger and just learned a lot in that. And I had 7 promotions in 8 years. So I had a lot of really good experience. And I learned that you just, every time someone asked you to do something, you said, "Okay, where's the hill? Give me the flag." And you would, you'd get results and you'd move on to the next. So that was the most important experience I think I had. I actually, in behalf of that company, I invested in some startups. So I sat on boards. So I got lots of really good experience along the way.
And then, so as you're going down through it, so when you look at it from a business perspective, did you look at it from the profit and loss? Did your mind change? And, did you look at the health, how do you differentiate between what kind of impact you can have on healthcare versus the profit and loss? And does it ever come in?
Every day. So, I've been fortunate enough that I've been in a situation where I was always felt like I could do the right thing. There were times, 2 career couples, times when I was making sure that I was working and couldn't take risks. There were at the other time, with big promotions that I would have. And then my husband, when I was up against something where I'd had to make a decision, it was always a matter of, you do the right thing and, I'll back you. So I always felt like I had the wind on my back. I never
Well,
had.
I like that. I like it. Do the right thing and I'll back you. Well, that sounds like a great relationship.
It's over 50 years,
Oh
so
my God, that's amazing.
I was married as a teenager, and we'll just leave it at that.
Okay.
But I think the most important thing, I've had the benefit of being able to always take a look at using smart money to do the right thing for healthcare. So that was really important. I have never entered when I started, one of the topics we were going to talk about is what's it like to raise money in tough times. So I raised a fund in 2008. That
Mhm.
was really fun. Okay. But the mission of the fund was I was in the middle of Central Virginia. This is the home of Philip Morris, Circuit City, CarMax, nothing from a life science perspective. But I was on the Biotech Research Park board appointed by one of the governors, and we recognized that we had technology that was emerging around the university, VCU, and some of the other universities, but no funding to do anything with. So I got put on the board. We decided to start a life science fund, and there was no technology. Even though, and the community folks in the community all stepped up. High net worth folks that lived in the community were solid Virginia citizens. A lot of them put money into that fund. They didn't necessarily make a lot of money out of the investments we made, but you can't now in Central Virginia or in the city of Richmond throw a stone without hitting four startup life science companies. So we
Wow.
enabled the building of the ecosystem. And now I have to compete for people. There was a time when, we didn't have anybody around to hire into some of these high tech positions. Now I'm competing with other folks. Thermo Fisher has a division here. So building the ecosystem. In that case, the mission was clear. You raise the money to enable life science startups. So you use smart money to do the right thing. In every one of the other jobs I've taken and the other, like the couple of startups I've done with this particular lead investor, it's always been about changing clinical practice as the centerpiece, and then using smart money to do the right thing. So for me, and that's the nurse in me,
Yeah.
the evangelist, if you will. And I've had the benefit to work with some of the best physicians in the country who were aligned in that. I mean, in the business of chest pain management, myself and a group of physicians across the world, actually, that we worked with, we literally developed, established, took to market all of the cardiac markers that are now as part of diagnosis. So when you go into an emergency room now, every blood test that they take to figure out whether you're having a heart attack or you need open heart surgery or you need a stent, this particular group of folks helped develop and launch. So it's rare that as a nurse, a lowly nurse, if you will, gets a chance to change clinical practice. And I had the opportunity to in-license the same kind of capability in brain injury. And so
Wow, that's amazing. So let's go back. Let's talk about it. So in tough times, how tough are the times right now in terms of raising money? So let's talk about that from your perspective. And is it the institutional investors that are tough or the family offices tough? I mean, how is it?
you're talking about now?
Yeah.
Yeah. So over the years, as I have raised money, invested money, raised funds, been part of advisors to funds, et cetera, there's been a real shift because in the olden days, call it 20 years ago, it was a real clear demarcation. There was seed money available. You knew where to go for that. There was mezzanine financing. You knew where to go to that for that. And then there was institutional big VCs, and the VCs would break themselves up in, investing in mid-sized companies or larger investments. Over time, before it was high net worth, family offices gave money to VCs to do the professional investment.
Right.
And there was a whole period in which family offices thought they could do it on their own with that, and they were going to invest their own money. I actually am seeing a slight shift back now, I think, in the last, I would say probably 2 or 3 years, because I'm talking to a lot of family offices right now, where they've either gotten better because they've made bad bets, or they are going back to aligning themselves with more professional investment capabilities, whether it's a small family house or clustered together with a group who often, in the VC days, they'd call it syndicate, but they'd invest together. I will tell you that the life science fund that we had built was a series of committed, high net worth, really savvy, ex-presidents, ex-CEOs, ex-IPO guys who'd made a lot of money, who were doing the right thing, but always they were driving to do something they believed in. More important, and when somebody asks me about picking investors, I won't let just anybody invest along in the companies I'm running. You've got to have the right investor base, and you've got to have the right board, and they have to be aligned with at least the objectives that I have, which is to build the company as the primary focus, and the company becoming successful makes them successful, versus investing in a company thinking it's going to be a big financial hit. I always categorize everybody who gives me money. Are they strategic or are they financially motivated? Everybody at the end doesn't put money into a company to lose it. But if they are only financially motivated and not about the mission, I won't take it. And I've turned down investors.
Wow, that's interesting. So tell us a little bit about. I know you're doing BrainBox Solutions. Tell us a little bit about that, and then Southeast Life Sciences.
Oh, okay. So BrainBox Solutions, I had the opportunity while I was as I was leading, as I did the fund, I was the lead investor in a technology we brought to the United States from Israel. The story goes back. One of our governors, actually George Allen, it was, recognized that we needed to develop more technology in Virginia. He developed a relationship with Israel ahead of many other governors. We were the only state that has a Virginia-Israeli advisory board where you talked about bringing high-tech technology from Israel to the States, or to Virginia. So we had invested in quite a few Israeli startups. One of them was ImmuneArray. I led the round of investing, became the CEO at the board's request, because the person I brought in, they didn't think had enough urgency. And during that period of time, one of my cohort or colleagues from the cardiac marker days was at Hopkins. And she asked me to come up and see her, and she shut the door and laid out a portfolio of discovery in traumatic brain injury that was, way above, filed ahead of all the rest of the folks, any of the other big companies. And I went to my board at that point and said, I think you'll be happy. I'd like you to allow me to in-license this in, and we'll see what we can do with it under the covers. So we brought it in, and now it's the leading asset. ImmuneArray is now in suspense, and it is the leading asset. And so we invested quietly, or got investments from other outside companies in the technology platform while it was under the cover of ImmuneArray. And then an investor who had led another round with me at a previous company I'd licensed some technology in Germany and came to me and said, I am seeing every day, every week, 5 or 6 companies who claim they have the answer to the TBI problem. They have 100 subjects and they think they're going to take it on. And it is the most disorganized space I've ever been in. This is a VC that supported the first TAVI device. So, very dedicated for first of kind of things. And he said, I don't think there's anybody else that can straighten this field out except you. I will back the technology I've watched you take. This is like 10 years after my first relationship with him, and I've known him a long time. And he said, but you've got to spin it out and you've got to run it. So I went to the rest of the board members, and we ended up spinning it out as a standalone. So by the time that it was a standalone company and we raised our Series A, it had already been in development for about 6 years quietly. And that's, we'd made a lot of progress. We'd had some corporate support. I was an NFL GE award winner when they had that Head Healthy Challenge. And had some additional support from corporations. And so we spun it out in 2018. And took our first study that we did while it was inside the other company to the FDA as a pilot, got breakthrough designation, and then COVID hit. So on the subject of, we were making great progress. We had a big European investor, one of the leading ones globally and certainly in Europe. We're in for $10 million. It signed a term sheet. We're ready to invest. And then COVID hit and they were scared. And so they backed away at the last minute. So I had to scramble then. 2 years later, I had to do another scramble because a similar story of a large investor of a sovereign country was wanting to come in just as we were getting breakthrough designation, and it still it had difficulties moving the money, et cetera. So I had to scramble again. So I've had two $10 million for sure investments in place. And both, they went away. So you have to continue. You have to have a good board. You have to be raising money all the time, but you have to be absolutely focused on the mission so you can keep telling the story. It's a marathon, not a sprint. But as long as you keep making hitting, they call them milestones, but I call them progress points. They aren't necessarily the big valuation incremental levers that people like. You get an FDA clearance, but you start the study correctly. You keep enrolling the patients at a faster pace than normal. You bring in more and more of the leaders in the industry who leave other companies to go stand by you, who will stand on the stage and say, nope, she's doing it right, or we're doing it right. Mm-hmm. So you just continue to make progress every day, and you can stay funded. The thing I like to advise people around, you have to be capital efficient, and I don't think it's smart to over raise funds. Like, I've never gone out to raise like 20 million. Sometimes you feel more comfortable if you've got a lot of money in the bank, but your company doesn't run as efficiently and leanly if you've got too much. So I always like to be, just enough ahead that we can always keep going, but also because of the quality of the investors I have, I always know that, one of them's got their hand on my one shoulder and the other one's got the other one. And I always know they have my back. So if you get up against it, you're never, ever going to be out of funds, even though it feels tight sometimes.
So I got a question for you. If you have a company, and I'm just curious about this. I have one of our companies, a molecular isolation bioiodine company. It takes it that it's 3,000 times more effective. A guy named Jack Kepler is the person the top iodine expert. They have it. The company's got contracts. How in the world? What's the best way for a company like that to get the funding? I mean, they have agreements in place and those kind of things. But what's the best way for a company that can make a profound impact? You're right, in hospitals, and they have agreements in place. Well, again, in a lot of details. But what's the best way for funding? Because it's I found some investors, but you need somebody that really gets it. You know what I mean? That really understands. Say, listen, this is going to make a dent in the universe.
Yeah, your investors have to be very clear in what you're doing. I mean, I will tell you that because I'm setting a new standard of care for traumatic brain injury and concussion management, I cannot tell you how many of my investors are ex-hockey players or NBA All-Stars or folks that have had a concussion and know that something has to be done, and they're in because they understand it. So whoever you're talking to has to have a real clear idea of the impact. And you say you have contracts in place, but sometimes contracts are just documents that have information on them, but the execution and adoption isn't there? I mean, market adoption is the key in everything.
Mm-hmm.
And just because you're doing a contract doesn't mean that there's a commitment to execute.
Mm-hmm.
I found that lots of times over the years. People talk about it, but they don't necessarily, they don't necessarily move on it all the time. So it's really the adoption of and execution of that's the key issue. Now, again, when you were describing it, is this this is not a pharmaceutical. This is an antimicrobial,
Yeah, I'm antimicrobial.
right?
Yeah,
Right.
so I mean, it's in fact, I have some here actually. That's,
Well,
I, I wanted to try it, Donna. I said, I'm gonna, my dog had the skin infection, and the vet said there's nothing that can be done. So I said, what the hell? I'm gonna take this and put it on because it's like this, yeah, super iodine, and it's no more toxins than regular iodine. Anyhow, I put it on my dog, and it was unbelievable. Her skin cleared up. And we had tried for years to get something. I tried medicine, I tried pills, I tried everything. And so whatever it is, it's just interesting. I just that as an example because, part of it is trying to find the money. Where do you find the money that's the right money? And I think the challenge today is how to find the right investors because it's like it's inside that network, but it's like the secret squirrel society. You don't know who to talk to.
Right. That's exactly right. And there are more and more folks specializing in. I mean, that's how I met you. Remember, who have a database of of family offices that they're working with,
Mm-hmm.
and I can't tell you how many have come to me and said, we have this network. I can guarantee that you will, that will get you funded, and this is the process, and upfront there's this much, et cetera, et cetera. So, and you pay as you go along the way. You have to talk. Somebody told me, somebody who just sold a really good friend of mine who sold his company for 5x. We were colleagues in another company before. He said, boy, did I have to kiss a lot of frogs. So, you just have to keep talking, and you get better. For me, I get better at understanding early on where you spend your time.
Mm-hmm.
You can, you take a look at the profile. You can either say in 5 minutes, I'm a fit. I mean, there are funds that have time fits, size fits. I've only got this much in my fund and I've got one more investment. So somebody who knows how to screen that for you so
Mm-hmm.
that when you go, you are looking at, in the sales jargon, a qualified prospect, if you will.
Yeah.
So that you don't waste that upfront time getting to the right people, for sure. I'm resonating to what you talked about because one of the companies we invested in that was started in Israel and we brought over here was an antimicrobial, and it got traction in some big hospital systems, but it was really bad board management.
Mm-hmm.
And friction within the board and the management players that got in the way. So very important to keep a good team, very important to have your team understand, your mission and stay with you. The worst thing in the world is to have somebody that's been with you for 3 years gets, recruited away or leave because they don't understand where you're going. Everybody's got to be on the same train. And it never really got to the capability that I knew it could have. I wasn't running it, my partner was. But because it dealt with board friction, management, egos got in the way of a really good contract, and the person on the buyer's side didn't get along with the person inside the board, and then that slowed things down. So it's you just can't let friction happen.
No, I hear you. I mean, it's tough sometimes, isn't it? It's amazing how people get egos when you're on boards.
People are people.
Mm-hmm.
Rich,
Yeah.
high, short, fat, tall, skinny. They're all people, and you always have to understand what's going on in the other person's head.
Mm-hmm.
And continue the process. You always have to be making progress every day. I used to have an analogy is once you get some momentum, you're a train leaving the station. You can always, push through rubble in front of you. If you get rocks, it's, rubble, rocks, and boulders. If rocks fall in your way, and that's people getting mad at each other and something happening that you may not have predicted, you can usually power through rocks. But if you come around a bend and a boulder's in front of you, you stop the momentum. So the key is to always keep the momentum going, and just always look ahead on what could go wrong. I mean, that's the old sales adage. And also, from a nursing perspective, you're always thinking about what the complication could be that you're avoiding.
Yeah.
So, I have fallen back so often on my emergency medicine days. Folks have asked me why I'm able to make decisions as quickly as I can. It's because I always knew then you only have so much data in front of you. You make a decision based on the data you have. You go with it. More data, you can pivot, but you can't overanalyze. You have to just know when is the right time to make the call and keep moving. But keeping moving is the key.
Well, I like that. When you need to know when to make the call and keep moving. Yep, I'm here. Can you hear me?
Gary's frozen.
Can you hear me? Can you hear me? Can you hear me, Donna? Hello, hello, hello. Can you hear me?
That's right. And you can pivot afterwards. Yeah, well, you were frozen for a minute. You can pivot afterwards. I can.
I think there's a little
delay.
delay.
I can hear you, Gary. Hello, hello, hello.
So, Donna, listen, closing thoughts and how do people get a hold of you? Can you hear me?
It's not me.
Huh. I have a good connection too. What is going on? I don't know. Can you hear me now? Can you hear me, Donna? Can you hear me? Okay. Chat.
I'm on LinkedIn, Donna Edmonds. Yeah, I can hear you just fine, Gary.
Okay.
Yeah. So again, you can BRAINBox Solutions. You can look it up. I'm on LinkedIn, and I do answer that. I am not a Facebook aficionado, but certainly I can. Anybody who's interested, Jane, you're a very able assistant, can get in contact with me, and I appreciate being here. It's been fun getting to know you and watch the other shows.
Well, thank you for your time, Donna. And thanks to everybody for joining one more time. GSD Presents. My name is Gary Fowler, and I'm your host. Stay tuned for another exciting edition coming Thursday. Stay happy, stay safe, and stay healthy. And I'll be back to you soon. Take care, everybody. Thank you.